Hello, my name is Dr. Gregory Davies, and I am a professor of Obstetrics and Gynecology at Queen's University and the president of Stittsville Medical Imaging Center, where we offer the Mona Lisa Touch as a treatment option for the common vaginal and vulvar discomforts associated with menopause. In this chapter, I will explain how replacement estrogen can help reduce or eliminate the bothersome symptoms of the vulva, vagina, and bladder associated with menopause. The standard treatment for the genitourinary symptoms of menopause is estrogen. It has been available for more than 50 years and comes in various treatment forms, which we will explore. In 1966, Dr. Robert Wilson was the first to recommend estrogen during menopause in his book Feminine Forever. This was soon followed by the introduction of a package of 2 tablets that included both the hormones estrogen and progesterone, which was called Prempro. Now there are many types of prescription estrogens available, either alone or combined with progesterone. Estrogen, either alone or combined with progesterone, is now available as a tablet, a cream, a gel, a vaginal suppository, a vaginal ring, or as a patch. Estrogen works well at controlling all the symptoms of menopause, including hot flashes. However, 40% of the women using estrogen by mouth or in patch form will still have vulvar, vaginal, or bladder symptoms. Estrogens used locally are effective for vaginal or vulvar dryness, but they won't stop hot flashes. Women using local estrogens commonly find that the treatment works well for their vaginal dryness, but less so for their vulvar symptoms. Overall, 80 to 90% of women respond to estrogen treatment. When women take estrogen for their menopausal pelvic symptoms, it reestablishes normal blood flow to the vagina and vulva. Estrogen enhances the tone of the pelvic structures, including the bladder. All of our skin is covered in bacteria, including the vagina. That's normal. Estrogen restores the normal bacteria in the vagina, reducing symptoms of itch and odor. Estrogen can improve the symptoms for women with urge or stress incontinence. Although estrogens are effective, they are not for everyone. Some women, like those with estrogen-sensitive breast cancer, or those who have had a blood clot in their leg or in their lung, cannot use estrogens. Some women feel uncomfortable taking medications that contain hormones and make a conscious choice to avoid them, even though they could be helpful for their symptoms. And some of the women who have tried using estrogen find it ineffective. Usually that is because they can't remember to take it as often as it is prescribed. To be effective, estrogens need to be taken continuously, and as soon as they are stopped, the symptoms will return in short order. Despite being effective, not all prescriptions for estrogens get filled. Only 25% of menopausal women ever use estrogens despite having symptoms. Of these, almost 40% stop using them within the first year of treatment. Statistics Canada has identified that only 7% of Canadian women aged 45 to 64 use estrogens. If estrogens have been available for more than 50 years, and only a few women are using them long term, then there is an obvious need for a non-hormonal alternative, something that can have the same effectiveness as estrogens, but isn't hormonal, doesn't have to be taken regularly, and doesn't have significant side effects. I hope you found this review educational. If you would like to book your consultation to discuss the Mona Lisa Touch treatment for the genitourinary symptoms of menopause, call Stittsville Medical Imaging Center at 613-714-1000.